Intussusception. So what is intussusception? It is a life-threatening condition where the section of the small intestine folds into an adjacent section that can cause blockages. So in this photo in the top right, you can see that this is the small intestine, and then right here is where the intussusception is happening, how it is folding into itself basically. This is a picture of it pulled out of a cat, and then over here on the right as well is a wide shot of how it all will look. So how do you prevent it? Unfortunately, it cannot be prevented fully, but you can reduce the risks by maintaining regular deworming and flea tick prevention. You can watch the feline's diet and avoid any sudden changes to it. You can live in a parasite-free environment as best as you can. You can prevent access to string objects that are easily ingested. And then if you think there are digestive issues or they have ingested a string, you should seek a vet. What tests can be done? So there'll be an abdominal ultrasound, which it will look like a bullseye mass on the ultrasound itself. There can be an abdominal x-ray, which will appear as a soft tissue mass, kind of like a giant circle. There can be a contrast study where the feline is injected with contrast, which can then show bowel distension in the proximity of the intussusception. There is a physical examination or palpation where they feel, and if it feels kind of firm in sausage shape, then it is most likely the animal just have it. There is blood work, which is the CBC and a biochemical panel. It looks for dehydration and electrolyte imbalances, as well as elevated or low white blood cell count and anemia from blood loss. There is the surgical exploration, which allows for a direct visual of the intussusception and can be treated that way as well. So these photos right here, in this left one is a ultrasound of the intussusception. It shows this bullseye target right here. Then on the right, it shows the sausage length as well. And then down here is an x-ray showing that the intussusception is all around in this abdominal. Is it chronic or acute? It is actually both. For the acute, it is a rapid onset of symptoms, which can be sudden severe pain, vomiting, or mucus-filled diarrhea. There is a high-risk mortality rate, and it can be fixed with surgical intervention. Chronic is intermittent symptoms. They seem less severe, but they're more sporadic and can be changes in the appetite, fatigue, and vomiting. It is diagnosed as chronic, and there is a treatment as well. So what are the treatments? There is the emergency medical stabilization, which also has the aggressive IV fluid therapy, which does correct the dehydration and the electrolyte balances. Pain management, which can be given via medication. Antibiotics, which are administered through injection or IV fluid. And then anti-nausea medication, which is typically given orally. Some other treatments are surgical correction, which they will open the stomach and then do a manual reduction. If it is caught early and the bowel is still in good condition, it can be easily manipulated to go back to normal. If it is not, then resection and intussusception will occur, which is removing a section of the intestine that is too damaged or dying. There is also enterocal application, which is the reduction of the chances of reoccurrence. By that, they will do loops in the small intestine and then gently stitch them together. Post-operative care. You want to continue the fluid therapy to make sure that they drink and eat without vomiting, pain management with the oral medication, watch their diet, and then if any other underlying causes, seek medical vet attention or continue treatment and medications as necessary. Routes of medication administered. So the primary way is through IV. Then they can do the subcutaneous or injectable, as well as oral.
Okay, sure.
Thank you. This is my terms. And then here are my citations.